Hi, I'm Julia, CEO of Vayla Health. We're building the phone-based visibility layer that makes care at home work for the frailest, highest risk patients, including the rural and underserved populations that traditional models struggle to reach. 9 million US adults live with frailty. That's 85 billion in excess annual healthcare cost. Frailty isn't just old age. It's a clinical condition where small issues like dehydration, UTIs, or a failed care visit become hospital crises fast. After developing a chronic illness myself that left me isolated for months, I became pretty obsessed with the invisible hours when health changes and no one is there to notice. I built my startup muscle at Deliveroo, helping scale the business through IPO and launched their 0 to 1 grocery service where I turned messy operations into repeatable systems fast.
And I'm Haji, the Chief Medical Officer. I've spent 9 years as an NHS doctor caring for older patients with complex conditions. I've seen time and again that hospital admissions for this cohort start at home, in the gaps between appointments that clinical teams are just too overstretched to cover.
And I'm Jesse, CTO. I spent years building AI and data infrastructure at Apple, learning how to make sense of messy, high-stakes signals at scale. That's exactly the challenge of building for frail patients. They aren't a standard digital health population. Baselines differ, memory loss is common, and deterioration is subtle. I'm building Vayla to catch deterioration early, learning each patient's normal through ordinary calls and surfacing it to clinicians before it escalates. No app, portal, or device.
Vayla captures health, function, and social recovery signals so care teams can focus intervention where it matters. We've completed 160 expert and patient interviews, and our first pilot launches next month. We're applying to Techstars to bring our NHS insights to US payers and providers and build the category for frailty at home.